1. Choose a mild soap. Many soaps contain perfumes that may irritate sensitive skin, and some contain cleaning agents too harsh for use on the genitals. For best results, choose a mild, unscented soap meant for use on the body. In other words, do not choose hand soap. If you have sensitive skin, ask your doctor or dermatologist about choosing soap that's right for you. 2. Take a shower or bath. Use warm water, rather than hot water, to avoid burning or irritating your genitals and the rest of your body. Shower as you normally would, washing all over with warm water and the mild, unscented soap you've chosen. 3. Wash the penis. Lather up your choice of mild, unscented soap between your hands, and apply it to the testicles and shaft of the penis. The key thing to remember with an uncircumcised penis is to wash under the foreskin. 4. Keep it clean. Personal hygiene is important, but doctors warn against overwashing the penis. Washing too frequently, especially with soap or shower gel, can cause soreness and irritation. You should also thoroughly dry the penis after showering. If you use talc or body powder on your testicles, resist the urge to powder the penis. If talc gets under the foreskin, it can cause irritation and discomfort. 5. Understand foreskin care. With proper care and hygiene, having an uncircumcised penis does not present any significant health problems. However, failure to clean under the foreskin can cause a buildup of oils and debris, called smegma. Other common foreskin problems include inflammation, usually caused by forced retraction and irritants like harsh or perfumed soap. Infection, such as posthitis and balanitis, typically caused by poor hygiene and unwashed smegma buildup.